We're going to be covering orthodontic emergencies and using this model. When you first seat a patient, you're going to ask them about their elastic wear. And most patients that are wearing their elastics like they should, you'll know it because number one, they'll have them in when they come into the office. And second, you always want to tell them, go ahead and put them on for me. And so that way you see if they're hooking them up right. And also if they do it without a mirror, they can do it by feel, then they're doing it on a regular basis. So you want to ask them, are you wearing like single class twos, one on each side, two on each side, a triangle, a fox box for anterior closure? When do you put them on? Because a lot of patients, you'll say, do you wear your elastics? Yes, all the time. Well, all the time to them might mean, a majority of the day at school, but then they take them out for sports and don't put them back on until night. And so that could be from 3 in the afternoon until 9 or 10 o'clock at night, and that's a big chunk of time. So the question you want to ask is, when do you put your elastics on? My daughter would say, I put them on at 6:30 before I go to school. She takes them off for lunch, she puts a new pair back on, she comes home, she gets a snack, takes them off, puts a new pair on. She wears them genuinely all the time. And so you count those hours up if there's a chunk of time where they're not wearing them. And then you want to ask them, do you wear headgear? Yes. All right, go ahead and put your headgear on because you'll need to make some adjustments to it. If they're wearing their headgear, then you're going to be moving up in the different holes that are on the side of the headgear. And then you ask them the same thing, how often are you wearing it? When do you put it on? Well, I don't wear it at school. I put it on at 3 o'clock when I get home. I take it off for dinner, and dinner's around 6 o'clock. I put it back on at 9 o'clock before I go to bed. What time do you wake up? 7 o'clock. So you might be getting 10 hours of wear out of that headgear. Check brackets with a scaler. And so what you're doing there is just kind of pushing on them a little bit to see if they're loose. If it moves, well, then that might have messed up your treatment plan for that day. So if one of their brackets is loose on the upper and you're supposed to change that upper wire to a 20 stainless steel, then you're not going to be able to do that if you're scheduled for 20 minutes and the schedule's packed. So that's a conversation with, the parents that brought them. We found a bracket off on the front, or we found a band loose. That's going to take about 30 to 40 minutes, and we can fix it today and work them in and out of the schedule, and that will probably take about 30 minutes to an hour, or you can bring them back this afternoon at 4 o'clock when we have an opening. What would you like? And so that would be a really great conversation to have with the parent. If there's an opening in your schedule, there's nobody scheduled after that, then go ahead and ask the clinical coordinator or the orthodontist, hey, there's a bracket off. Do you want to fix it? Yeah, let's go ahead and do that. And then have a conversation with the patient, hey, how did that bracket come off? And if the patient says, oh, I was chewing gum, or I was resting my Coca-Cola bottle, under my bracket and bit down, or someone pushed me, just record how it happened. Because in our office, we would say, 3 strikes, you're out, then you're going to have to start paying $65 per breakage. Obviously, if you do that, you have to make sure it's in the contract. And if it's not, you have to redo the contract so you don't break any truth in lending laws. You check the brackets, you check the bands, just kind of, lifting up on the bands. Check the bands if it's the ring that goes around your tooth, if it's, the one that slides on the entire tooth. Check for what's called washout. If any of the glue has come out and you see a space, that's called washout. The glue has washed out, and what that leaves now is an empty space for food and saliva to get packed in there and not get brushed out, and it's just a big cavity waiting to happen. So check the bands for looseness and for washout, and then check for any wires not engaged. If this is a 20 nickel titanium flexible wire and it's not seated all the way, then you can't go on to the next wire. So you're gonna have to seat that wire all the way, fully engage it with a power O or one of your stainless steel ties, you know, to make sure it gets in there good. And then make a note of that to check to make sure all rotations are out so you can move on to the next wire. If all is good and today's there's nothing broken, then today's appointment says change upper arch wire to a 20 stainless steel. Let's go ahead and take that out and get a 20 stainless steel measured to the old wire, set it aside, and then once the orthodontist checks everything and says, yep, go ahead and put that wire in, or yes, we're gonna use that wire, but I'm gonna step up, you know, the upper right canine or whatever, then you're ready to go. And what you don't want is to place the patient in the chair and take a wire out and then find a bracket off. So make sure you check ahead of time to see if anything's loose, because if you go ahead and take the wire out and you just say, well, I already have the wire out, let's go ahead and fix it now, then the schedule's gonna run behind. Let's see, wire out, then final breakage. Okay, so a patient leaves and everything is looking good. We used to have these emergency sheets that we would fill out for the patients. And so when you're looking at this emergency sheet, it's a non-patient day, Friday, a patient calls and says, I have a pokey wire. So we would get one of these emergency information sheets. You put today's date, and then you put the next appointment date so that you know, okay, well, they were just in here 2 or 3 days ago. Their next appointment isn't for another, 4 weeks. That's gonna matter what happens. And then what the appointment time is. And then here, somebody has not filled this out completely. So is it a broken or loose bracket? Is it elastics? Is it a pokey wire? Check off which one it is, and then write clear instructions. So this one says, rubber band needs replacing on side. Well, which side? Had jaw surgery recently. Give me an exact date. Was it 2 weeks ago? So if this was a settling elastic, like a rabbit with upper right 4-5 to lower right 4-5, I want to know, what teeth it's hooked up to, and does the patient change them once a day? So let's get more specific, especially when we're charting, because if this ever comes back to a court case, then that documentation's all you have. So you want to make sure you have that. All right, so things we can do to prevent the patient from ever having to come in. There are simple things that you can do at home. When we do something like this Kobayashi tie, we call it a K tie, and we wrap it, there's 2 places that could cause a problem. The top part that the elastic hooks around, once you move it, you wrap that elastic around it, it's just like a coat hanger. The more you play with it and bend it, it's gonna break. The other thing is the little pigtail on it. Over time, it can pop out, and that's gonna snag on the upper lip. So you can actually tell the patient, either put wax on it, or sometimes you can take a pencil and push it so it's not sticking out anymore. And so if that doesn't work, the second step would be take a little piece of the ortho wax that you're given in your new banding kit and just smush it down and kind of pinch it around that bracket, and now it's nice and smooth. If there's a pokey wire on both sides, and this is a conversation you can have with the parents ahead of time, if there's a pokey wire on each side sticking out, that means this power chain did its job closing space, and when that space closed, it's like the wire got longer because the space got shorter. And so you might want to tell them, you know, there's a chance that both wires in the back could stick out once the space is closed. If that happens, just call us and let us know, and you can come in and we will clip the wires for you. If it's a round wire, you can cinch it in the back, so even if it does get longer, it's cinched and curved, not straight out and poking. And then that would save you an emergency visit. Or you could tell the parents, you know, if you want to try to put some wax back there, you know, if it's just a couple of days before the next appointment, that would be great. Any type of irritants that are rubbing the lips, hot saltwater rinses, and then wax, and that'll callus up just like when you have a wedding band on, and right there gets callus from the rubbing. And sometimes the color ties will come off. It's a big deal if it's, you know, 3 days after your appointment and you're not coming back for weeks, because that tooth is now going to pull away from the wire. And then making sure that your arch wires go all the way through the arch wire tubes, and that everything is cut flush if it's a rectangular wire. If it's a round wire, it should be cinched. And just letting the patients know ahead of time is an explanation. If you tell them after something's happened, it sounds like an excuse. So you want to go ahead and prepare them that yes, sometimes there are minor emergency visits where they're uncomfortable, and you want to make sure that you fix it so they are comfortable. Okay, so there's most of the emergencies right there. There's another thing. If there is a wire that's really bothering them and they can't get to you, there are some orthodontists that will step up and say, hey, my office is open. If you ever have anybody down in the Myrtle Beach area, you know, tell them to give us a call and we'll cover them. And that's, some orthodontists do that for each other once in a while. But these can be purchased on Amazon, or they can be purchased at a CVS. A lot of them, you know, they're called cuticle cutters, but we call them ligature cutters. And so if there is a wire poking, you can actually take one of these typodonts and show the parents. They'd go right here and just clip it. And, you know, once upon a time, you had to learn how to do this. And I've shown hundreds of parents how to do that. And it saved us from having an emergency visit. It saved them on vacation having to take time out of their vacation to go somewhere. So parents can do a lot more than, you know, we give them credit for. So wax, nail clippers, or ligature cutters can get rid of some of these things. Okay, and now with the wonderful age of technology, they can actually FaceTime you and say, this is what's going on, and you can see and sometimes walk them through it. So taking care of the patient when they first come in and trying to prevent emergencies, and then being specific with your charting and what to do in the event of those minor emergencies.